very good day all of you. I am Dr. Priyanka, consultant gynecologist of Siu-Ka-Pha Multi-Speciality Hospital, Shivsagar, Assam. Today, 4th February, on the occasion of World Cancer Day, I will be speaking a little bit about prevention of cancer cervix. Why cancer cervix? India accounts for nearly 1/4 of the total deaths due to cancer cervix in the world. So, awareness about cancer cervix and its prevention is very necessary. For its prevention, we can follow two very important steps, that is number 1, screening, and number 2, vaccination. Screening determines people in the precancerous stage. That means through screening we can detect people in the precancerous stage where they can be treated much before they develop cancer. Screening is done through pap smear and HPV DNA virus examination. Now, what is HPV DNA virus? This human papilloma virus, in short HPV virus, is responsible for almost all the cases of cancer cervix, and this can be detected through HPV DNA examination. So hence these two tests are very necessary. Pap smear is a simple test where we examine the cells of cervix through a simple we do a brushing of the cervix, and then we make a slide, and this slide is examined by our pathologist doctor for any abnormal in the cells of cervix. Through pap smear, this pap smear, as according to the guideline, pap smear can be done every 3 yearly, and HPV DNA virus examination can be done 5 yearly, or combined test we can do 5 yearly as according to the guidelines. So this screening can be continued up till 65 years of age, or even after that if the lady has got any history of operation due to precancerous lesion. Secondly, coming to vaccination, the vaccines available and approved are Cervarix and Gardasil nanovalent and Gardasil quadrivalent vaccine. These vaccines are very effective, and they can be given as early as from 9 years of age to 25 years of age. Although they can be given from 26 and prior after that also, however, efficacy is not the same as given prior to sexual exposure. This vaccine can be given at 0, 2 and 6 months if given after 15 years of age, and if given in between 9 to 15 years of age, then 2 doses are enough in 6 months of gap. And another good news is there that recently in India also an indigenous cervix vaccine called Cervical has been recently developed against cancer cervix. This vaccination is very important because as Australia has almost abolished cancer cervix through this vaccination. Even our neighboring nation Bhutan has prevented cancer cervix to a very good extent through vaccination. So in India also, because India contributes to a great major extent of cervical cancer death, so a thorough and uniform vaccination of the ladies are very important. Along with this, along with these two steps, screening and vaccination, we should be also aware of the symptoms we should be careful for. The symptoms like abnormal vaginal bleeding, that can be bleeding in between 2 menstrual cycle, or bleeding after intercourse, or even some very offensive like bad smelly discharge from the vagina, or any sort of like pain abdomen. All these things we should be careful of, or even during menses if there is a heavy bleeding, like and menses that occurs after menopause, or even in the perimenopausal age group, if there is heavy bleeding, any abnormal uterine bleeding or vaginal bleeding, they should be looked for, properly investigated. So this much little bit information about the prevention of cancer cervix. Thank you.